not gone on strike. This is because the county assembly passed a budget which enabled, the county government to channel funds to the health sector so as to ensure that the health workers are well taken care of. And our Nyeri-based reporter, Daniel Kariuki, has gotten the privilege of talking to Nyeri County Governor. Daniel Kariuki, good morning. Over to you.
Right. Thank you very much, Brenda. Right here at Nyeri County, some few minutes ago, the governor, Mutahi Kahiga, was pending the signature to the supplementary budget of the county, as well as the budget. And I'm joined by the governor here so that he can just break down to us concerning the budget, the supplementary budget. Thank you very much, Governor. Nyeri County, the clinic officers as well as the nurses have not gone on strike like we can see in other counties. Maybe you can just bring us to speed. And maybe have you as a county met the requirements, or rather the minimum requirements by the nurses and the clinical officers? That's the reason they are not on strike. How are you doing it different from the other areas?
Thank you very, very much. I must admit that we have not met all the demands of all the health workers, because there are quite a number, but we have done the majority. We have met the majority of them. And currently, as we speak, I am well aware that the other issues that are pending are matters that are ongoing, and they are being deliberated on. Some of them include promotions. Currently, if you observed, like last week, we have already advertised, and we have started the process of procurement to get a medical scheme for our employees. We already had it, but we have now enhanced ours so that it also has a component of COVID-19, and we are going to be spending about 193 million. The process is on. I think 3 days ago on Monday there was the evaluation, and we will be allocated. So moving forward, those are some of the things we are doing. We've been able to address majority of them, and therefore I want to appreciate the health workers of Nyeri in every way, the leadership of the unions, because they have been magnanimous enough to take care of our people, and the only people letting us down is the National Treasury, because they are not releasing funds to ensure that hospitals are well equipped. However, I am glad to say that we have in our stocks enough PPEs, enough gloves, enough masks, that would take us for about a month or two, and they are being issued to our health workers. Just to mention, every doctor gets about 5 masks per week. They are not enough, but at least that's what we are trying.
Right. And now maybe Nyeri County is one of the county that the universal healthcare system, the rollout, the piloting was here at the Nyeri County. Maybe you can tell us, has the UHC come in handy in terms of dealing with matters concerning doctors and the nurses? And of course, you as the county governor, you've been here for like 3 years. You've dealt with the health docket. Then can you tell us what has been ailing this system, the healthcare system, and of course matters healthcare? UHC, is it going to help in these matters to do with doctors and nurses?
Really, I must say that the biggest challenge in this country is that we underfund health. And this was the same problem we had in Nyeri, because when we took over, we had hardly 2 billion. Now, as the supplementary budget I've just read, we have allocated 2.9 billion to health. And that tells you clearly that we are progressing. One of the ways we will succeed under UHC is to ensure that counties must allocate a minimum of 30% of their budget towards health. And this is something we are doing. Yes, UHC, universal health coverage, is the key thing, and it is important that it succeeds. We had seen, we have had a change at the MOH. Initially, we were working with Waziri Sisele Kariuki, who had a different perspective and approach towards UHC. Now we have Senator Mutahi Kagwe, who has also come on board and has now changed the mode and how we are going to approach UHC. We are looking at it from maybe the NHIF component, and whichever way we are ready to support, because clearly if you look at our county mission, it is simply to have a county of healthy, wealthy, happy people. And you cannot achieve happiness, you cannot get wealth if you don't have health. And so that is why we are focusing really on increasing the budgets. And we have had 1 year trial, which was very good for our people. Now we are telling them it's time to go back to NHIF, pay the 500 per month so that you have a cover. And it is really an advantage to everybody, because if you had an issue of dialysis, if you had an issue of chemo, you realize that NHIF will take it up. So we are asking them to walk with this journey with us. We know that the Ministry of Health is like in Nyeri. We are going to register and pay for 20,000 indents. That is 20,000 people who may not be able to pay will get their NHIF cover paid for in Nyeri County. And that will help now show up it will show up the resources that come to hospitals, because these cards, when used in hospital, will bring some earning to the hospital and will be able to provide.
You've spoken, first and foremost, you told us that you, as a county, you've not really met all the demands by the nurses and the clinical officers. Should there be maybe anytime the nurses talk of going for a strike, you as a county government or the governor, have you put any measures that maybe you are going to have
let me put
talk
it
with
this way.
With the officers?
Let me put it this way. We must come up from our high pedestals and engage the unions. Talk to them. Listen to them. They are human beings. You sit and reason. This is what we can do now. This is what we can do in the short term. This is what we can do in the long term. And so I am proud of the unionists that we have within COCA, the KPMDU, and the Nurses Union, because together we reason. I know there are challenges, like now we are redesigning about 53 nurses who are supposed to be redesignated and then promoted. We also have pending promotions, which we are, actually the board is actively on that matter. And the unions know that that is what we are doing. Some of these matters, let me tell you, are so pedestrian that we wonder why counties are not looking at them. For example, when health workers are not paid for 3 months, what do you expect? I mean, at the end of it all, we are all working, and we need to make arrangements to ensure that they get paid when they are supposed to get paid. So some of the issues, even listening to unions, because I am speaking from a background of a unionist. Yes. If you listen to the unionists, they will tell you what they can do. They also are living in a country where they know what is possible and not what is not possible. Right. And so I would want, number one, to say and tell the leadership of this country, kindly watch your words. This is no time to be talking rudely to doctors, speaking in, making careless remarks. It is time to engage with the unions, sit with them, listen to them, offer what you can offer, and with timelines, and they will listen. They are human beings. But when you ensure you are walking around and telling us different things, you are saying things that are even hurting to them, what do you expect? So I want to say that we have engaged with our unions, we sit with them, and their staff too. If you don't take care of staff welfare, what do you expect? Right. Yeah.
Thank you. Thank you very much, Governor Mutahi Kahiga, there telling us more concerning the healthcare system in the country. Then you're calling on your counterparts to ensure that they have negotiated with these unions?
Engage. I am saying this. You see, all of us must engage. And I want to really support the words of our chairman, Wycliffe Oparanya. He said that the 22 counties where the nurses and doctors have gone on strike, the only way is for the leadership to engage with them. Let's stop throwing words at each other. Let's stop talking at each other. Let's talk together. Let's sit down to a table and discuss. Our nurses are Kenyans. Our doctors are Kenyans. And if you sit with them on a table, they have demands. How many can you meet? When? And they will listen, surely.
Right.
Yes.
Thank you very much, Governor Mutahi Kahiga there, speaking on concerning the healthcare system. And of course, we'll keep following up on this and we'll keep the viewer updated. But for now, I take you back to Brenda in studio. Over to you, Brenda.
Daniel Kariuki Matt said nurses in that county are such a happy lot. Nurses and doctors, actually nurses and clinical officers in that county are not on strike because the county government has taken care of them. Taking us to, can I say, the final commercial break, but I'll be right back with more making the headlines here on a KTN News Center.